No one disputes that the quality of medicine practiced in Michigan is equal to that practiced across the country. Yet the cost of medical liability insurance in this state is 3.5 times the national average. Doctors were forced to create their own insurance companies to get coverage and keep costs down, when, in the 1970s, private insurance companies deserted Michigan because they could not make a profit. Yet Michigan doctors still have much higher premium costs than their colleagues in neighboring states. Hospitals have their own insurance company too, or self-insure for their losses. But a small rural Michigan hospital pays higher rates per bed than a hospital, for example, in San Francisco. And rates in Detroit are the highest in the nation.
It means in practice that when the cost of medical liability coverage goes up, hospitals are reducing the number of employees, are reducing the number of programs, are curtailing their purchase of new equipment to institute new programs, and in the end it means that Michigan citizens receive fewer health care services.
People need to be aware that the services they hold near and dear, physicians, hospital services in their own community, are in real jeopardy if the malpractice climate is allowed to go unchecked.
Well, I think we are beyond the point of finger pointing, and at the point where we must recognize that we have an access problem, we have a cost problem, we have a system that is not working. It's not working for the patient. It certainly is not working for the providers.
It does equate to runaway cost for health care, and people are concerned, and they should be concerned about the cost of their health care.
As the direct cost of the medical liability crisis erodes access to affordable medical care, the indirect cost jeopardizes the quality of life and the economic health of Michigan.
In your state, more babies die than do in most underdeveloped countries. That's very embarrassing. How do you attract major businesses to an area like that?
Right now, Michigan has the third highest effective tax rate of any state in the country. And when you add our cost to health care to that, it does become a much less attractive place in which to do business.
I think everyone loses. Even the folks who think that they're winning lose.
The patient, the communities, the employees of our hospitals, the physicians that want to practice medicine like they were taught, instead are practicing it as though they were appearing in front of a judge, defending their very actions, everything they do.
That's not the way to practice medicine. The way to practice medicine is to walk in the door, say, how are you doing, what's your problem, let's see what we can do about it. But unfortunately, that's not necessarily the way it can be done.
I have probably 80 lawyers doing medical malpractice defense. We have the largest medical malpractice defense firm in the United States. Now that tells you something about the situation in Michigan. Why not California? Why not New York? Why not Florida? It's because we have a terrible situation here, and our society just can't afford this type of thing any longer.
Michigan's medical community supports a strong discipline system for substandard healthcare practitioners, timely and fair compensation for injured patients, and reform of the legal system that now awards huge sums of money to relatively few patients and windfall fees to their attorneys. Many chambers of commerce, large and small businesses, and professional and trade organizations throughout the state also support reform of medical liability laws for affordable access to health care.
It's very difficult to get across to the legislature the realities of the situation. They are bombarded regularly by a very, very effective lobbying group, namely the plaintiffs' bar. They have a golden goose, which they do not want in any way to be affected by virtue of legislation.
Our state legislators have heard from the doctors and the lawyers. Now it's up to you. Let your senator and representative know that you support access to affordable health care for all Michigan citizens and that you want their votes in favor of medical liability reform.